What's going on, ladies and gentlemen? It's your boy Nurse Bass back with another video. And guys, what I want to do real quick is I want to talk about the benefits of studying for the retention of information versus just studying for memorization. Let's get into it.
Are you listening? Nurse Bass. Beast mode. Grinding.
So guys, I'm coming at you with this pro tip today. No matter what stage of the journey you're in, whether you are an aspiring nursing student currently trying to complete prerequisites, or if you are already in nursing school, this video is geared towards you. So what I want to do is I want to talk about why it's so important to begin cultivating a habit of studying for the retention of information versus purely the memorization. You know, whenever you're taking prerequisites, anatomy and physiology, microbiology, chemistry, basically whenever you're taking your sciences, you could very easily get by and actually do very well purely studying to memorize the information. It gets a little tricky when you get to the physiology component of things, but for the most part you could make flashcards and just purely memorize information, go into test day and do very well. You could get out of there with straight A's. It's very easily done. However, whenever you get into nursing school, and for those of you who are currently in nursing school, you can attest to this, these NCLEX-style questions are so different than these prerequisite science-based questions, because no longer are you purely getting a question and regurgitating knowledge that you have memorized. Now you're being forced to take the knowledge that you have memorized and apply it in these NCLEX-based style questions.
Hey guys, real quick, I just wanted to let you all know about this amazing company called nursing.com, whose sole purpose is to help prepare aspiring and new nurses for success in this rewarding career. Links down below. They have 4 brand new academies available for whatever stage of the grind you're in. The Pre-Nursing Academy for those aspiring, the Nursing Student Academy for those in the trenches, the absolutely stellar NCLEX Prep Academy with over 99% pass rate, and a program designed to help the new grad nurse navigate this new and intimidating profession. Just pick the path that's right for you. But if funds are tight, don't worry, because nursing.com has a ton of other free resources available to you as well. One day, patient lives will be in your hands. Study like it. Links are in the description. Love you guys. Grind on.
So, what I want to do is I really greatly want to implore you, and hopefully I'm reaching a lot of prerequisite students to get this habit cultivated within you before you ever get into nursing school. But if you're currently in nursing school right now, you can start to develop these habits right now. So I really highly recommend that whenever you're studying these body systems, whenever you're studying anatomy and physiology, or if you're studying pharmacology or whatever part, med-surg, pathophysiology, start to study to retain. You know, one of the things that they tell you early on in nursing school is whatever you're learning now, make sure that you go back and you continue to refresh on it, because it's going to continue to pop up later on in your further semesters. It's very true. But more importantly than that, this is information that's going to be appearing on the NCLEX, right? So you got to pass the NCLEX. It's important that you start to retain all this information and carry it forward with you. But most importantly, this is information that you're going to just need to know and be able to apply whenever you actually get in the career. You know, it's one thing to know that the heart has 2 atrium and 2 ventricles. You know, it's another thing to know that blood gets ejected from the left ventricle up into the aorta, then it gets distributed to all the systemic vasculature throughout the body. Why? So that our tissues can get oxygen. Why do our tissues need oxygen? One might say it's to live. Another person might say because of the Krebs cycle. What is the Krebs cycle? Then you start to dive even deeper and even deeper, and the further that you go, the more easily you're able to pivot in test questions, the more easily you're able to take the knowledge that you have in your head and apply it to the question. And it sets you up for great success on these tests, but even more so, and I am a testament to this now that I'm working in the field, it sets you up for even better success when you're caring for these patients. Anyways, that was a mouthful. I'm kind of out of breath. I hope that you guys enjoyed the video. If you're new to the channel, be sure to hit that subscribe button down below. We're putting out content every week to motivate, uplift, and inspire you to be the best damn nurse you can be. Share this with a friend, man. Pro tip. It's your boy Nurse Bass. I'll catch you guys in the next video. Peace.
Born at the bottom, but now I'm top down. Look, I'ma call it swagger. I slip through time zones like a cloak and dagger. Mad rubies on my chain. You can see your name up below.